Glycoprotein defect diseases. The first link involves the eye cell disease. So eye cell disease is nothing but there is a defect in the mutation of the GNPTA. This is the gene that is affected. It leads to the deficiency of the enzyme of UDPN acetyl glucosamine 1 phosphotransferase. UDPN acetyl glucosamine 1 phosphotransferase. Now looking at the characteristic features, the eye cell disease, there is the coarse facial features, there is the corneal erosions, as well as there is failure to thrive, and there is hepatomegaly. Next we are looking at the leukocyte adhesion deficiency. This is the type 2. So here the defect is in the there's mutation. It affects the Golgi located. There's a GDP fucose transporter, and the characteristics, it involves the neutrophil rolling. There's also the life threatening, there's recurrent bacterial infections, as well as presence of the psychomotor and the mental retardation. Next we are looking at the paroxysmal nocturnal hemoglobinuria. It is a defect, genetic mutation leading to the inability, so basically there is no synthesis of the glucosyl phosphatidyl ionositol, that is a GPI. So basically there is inability to synthesize the GPI, and GPI anchor that binds to certain surface proteins. So what this does is binds to certain proteins, surface proteins, and the surface proteins is present in the cell membranes. Now what are the characteristics of the paroxysmal nocturnal hemoglobinuria? The clinical features, it involves there's lysis of the red cells. There's also the abdominal pain. There can be back pain as well, and there's esophageal spasm can be seen. There's also the erectile dysfunction, and there is presence of fatigue. There can be the chronic renal failure, there can be thrombophilia, as well as the bone marrow failure. There can be the venous thrombosis, as well as the aplastic anemia. Next we are going to look at the Euler Donald syndrome. In case of the Euler Donald syndrome, it is nothing but a deficiency. The deficiency, or there is mutation in the lysyl hydroxylase 1. Okay, and there is also the characteristic, there is the neonatal kyphoscoliosis, as well as they can be part of joint laxity, and there is presence of skin fragility. There is also severe muscle hypotonia.